Hello everyone. We will learn the burns, scalds, and first aid measures. Burns and scalds are relatively common conditions in life. They can happen to people at any time. The light will bring pain to the patient. The serious will endanger the patient's life, but also bring lifelong damage. So understand the relevant knowledge of burns and scalds is very important. Learning target. 1. Familiar with the contents, clinical manifestations, and first aid measures of burning and scalding. To master the test point of burns, scalds, and first aid measures in the personal survival test, we will learn from the following. 1. The contents of burning and scalding. 2. Clinical pictures. 3. First aid measure. Part 1. The contents of burning and scalding. Burning injury refers to human tissue damage caused by various heat sources, photoelectric, chemical agents, acid, alkali, radiation, and other factors. Severe burn and scald is a common accident injury in emergency department. The prognosis is serious and urgent treatment is needed. Burn area estimation. 1. China's new 9 points method. Head and neck 1 multiply 9%. Upper limb 2 multiply 9%. Trunk 3 multiply 9%. Lower limbs 5 multiply 9% plus 1%. 2. Palm method. By holding 5 fingers together, the palm area of the patient is estimated to be 1% at the body surface area. Burn depth judge. 1. First degree burn, only superficial injury. 2. Superficial second degree burn, superficial dermis injury. 3. Deep second degree burn, injury to the dermis of the skin. For third degree burn, the whole cortex or even to the subcutaneous, muscle or bone. Part R. Clinical picture. First degree burn erythema type. It affects only the surface of the skin and usually causes redness, swelling, and tenderness. Second degree burn blister type. 1 shallow second degree, injury to the entire epidermis until the germinal layer or dermal papillary layer. Local redness is obvious. There are different sizes of blisters. Blisters are more full. The bubble is light yellow clarifying liquid. The wound surface is moist and red, soft in texture, sensitive to pain, and high in skin temperature. Usually 1 to 2 weeks to heal, leaving no scars. To deep second degree, the superficial dermis below the papillary layer is injured, and there is still part of the dermis. Locally swollen epidermis is whiter or brownish, occasionally with smaller blisters. The wound surface is slightly wet, slightly red or red and white. The texture is hard, and the sensation is dull. Usually 3 to 4 weeks to heal, leaving scars. Third degree burn Escher type. The entire skin layer is completely destroyed, and the injury is pale, dry, or even scorched. There is no pain in the wound. Airway burn. Burn injury classification. Lightness. Second degree burns under 9% of the total area. Medium degree. 1. The total area of second degree burns is 10% to 29%. 2. The third degree burn area is less than 9%. Weight. 1. The total burned area is 30% to 49%. 2. The third degree burn area is 10% to 19%. Extra heavy. 1. Burn more than 50% of the total area. 2. Third degree burn area of more than 20%. Part 3. Clinical picture. First aid on the spot. 1. Quickly away from the heat source. 2. Preliminary assessment of injuries. 3. Continuous rinse or soak in cold water. 4. Establish intravenous infusion channels. Emergency treatment. 1. Mild burns. Wound treatment. R. Moderate burn. 1. Oxygen and respiratory support. 2. Estimate the burn area and depth and evaluate the injury condition. 3. Liquid resuscitation and anti-shock. for wound treatment. 5. Sedation and pain relief. 6. Anti-infection, active prevention and treatment. 7. Burn sepsis. 8. Supportive treatment. Principles for treating minor burns. 1. Rinse the wound under the faucet until no pain is felt. 2. Dry the burn and cover with dressing. 3. Avoid unnecessary contact to avoid chafing the burn. Principles for the treatment of severe burns. 1. Prevent continued burns. Isolate the heat source from the injured and sick, such as clothes on fire. 2. Keep breathing. Check whether the injured and sick breathing gobstops, if there should be immediate treatment. 3. Check other injuries. Check the injured and sick. If there is any other serious damage, such as heavy bleeding, should be treated first, and the extent and area of the burn should be assessed. For cooling, rinse the injured area with water to reduce the temperature. During the washing period, close clothing and metal items should be removed, such as watches, rings, belts, etc., until the skin temperature drops to normal. But do not excessively cool the injured or sick. 5. Cover the wound. Cover the wound with sterile dressings, cleaning sheets, etc. 6. Quick hospital. Prevent or treat shock and send the injured or sick to a land hospital as soon as possible. The manifestation of strong acid damage in each part. 1. Skin contact wound surface is dry, the margin is more clearly defined. 2. Eyelid edema, conjunctivitis, corneal opacity, perforation, and even panophthalmia and blindness occurred in eye contacts. 3. Inhalation of strong acid smoke appears coughing, tears, chest pressure, severe dyspnea, suffocation. 4. After oral administration of strong acid, the mouth and throat, the back of the sternum, and the abdomen immediately feel intense burning pain, vomiting. Strong alkali damage. 1. The pain after sodium hydroxide and potassium hydroxide burns is severe and the wound surface is deep. 2. The burn degree of quicklime is deep and the wound surface is dry. 3. Ammonia water has a strong irritation to the respiratory tract, and in severe cases, laryngeal edema may occur. Strong acid and alkali injury treatment principles. 1. Remove from the scene and flush the wound with plenty of water. 2. Remove contaminated clothing. 3. Oral acid and alkali should immediately let the wounded oral egg white, milk, etc. to protect the digestive tract. The above content is that we learn about the burns, scalds, and first aid measures. That's all for this class. Thank you.